Hello.
Hello, I am Nicholas's mom and I consent to him being in the video.
Alright, perfect. Thank you, Mom. Alright, this is Nicholas, my 16-year-old brother. He's going to be my patient for today. So I'm going to start off with his abdominal assessment. Will you lie flat for me, please? Good, good, thank you. So I am going to first start by inspecting his abdomen. I'm looking at the contour. I want to make sure it's symmetrical. I'm looking for any skin abnormalities like bruising, any obvious pulsatile masses, maybe any surgical scars, which he doesn't have. Then I'm going to auscultate. So I'm going to auscultate all 4 quadrants. So I'm listening for hyper or hypoactive bowel sounds. If I suspected that he didn't have any bowel sounds in a quadrant, I would listen for at least 5 seconds before I would document absent bowel sounds. Next, I'm going to auscultate for breweries in his arteries. So I would do his aortic. I would do the renal arteries, the iliac arteries, and then his femoral arteries. From there, I'm listening for any bruits. Next, I'm going to percuss for his, first I'm just going to percuss his whole abdomen. I should hear mostly tympany. Next, I'm going to percuss for his liver, so I'm going to start right midclavicular line below the umbilicus, and I'm going to percuss upwards until it goes from tympany to tonus. Perfect, and then I would start right mid-clavicular line again, above the nipple line, and then percuss down to listen for when it goes from resonance for the lungs to dullness of the liver. Perfect, so the normal liver should be about 6 to 12 centimeters. If it was larger than that, or I found it abnormal, I could also percuss and measure it horizontally. Next, I'm going to go into palpation, so I'm going to start with light palpation. I'm going to palpate his abdomen for any obvious masses or pulsations, which I don't feel. Next, I'm going to go into deep palpation, so I'm going to use 2 hands. I'm going to press down a little more firm. Here I'm looking at his facial expressions to see if I'm eliciting any pain. Do you have any pain when I pull up?
No.
Okay. Feeling for rebound tenderness, which he's not having. Next, I'm going to palpate his liver. So I would put my fingers right below where I percussed for dullness, and then I would push up to feel the liver edge. And I would do that while he's breathing in. All right. Breathe in for me. Perfect. All right, perfect. Next, I'm going to palpate for his spleen. So I'm going to have him turn slightly on his right side. Can you turn to your right side a little bit, please? Yeah, just like that. So it's easier to feel the spleen when it's on his left side. It's easier to feel it when they're lying on their right side. All right, you can lie flat. I didn't palpate his spleen. If I could feel his spleen, that would be a normal finding. Usually, most healthy adults, it should not be palpable. Next, I'm going to assess his aorta. So I'm going to go midline, a little left midline, to palpate for his aorta. Perfect. So if it was, if it was greater than 3 centimeters, that would be abnormal, and that would warrant a further investigation. So I'm gonna have him sit up. Can you sit up, please?
Yep.
Next, I'm gonna assess his kidneys through. I'm gonna palpate for costovertebral angle tenderness. So I'm going to, can you sit with your back to me, please?
Alright.
Alright, that's fine. So I'm gonna go to find his 12th rib, his bottom rib, and then I'm gonna find. Alright. So I'll go down his 12th rib, I'm gonna put my palm over it, and then I'm gonna strike with my fist. Do you have any pain?
No.
Any pain?
No.
Alright, you can turn around. So that, I'm looking for, any rebound, tenderness, or pain. That could indicate a possible pyelonephritis or a kidney infection or renal colic. Alright, so next we're going to go into the musculoskeletal assessment. So first I'm going to start with his neck. I'm looking at the structures of his neck. I'm going to palpate. Alright, there's my feeling neck. I'm going to palpate his neck. I'm feeling for any tenderness, any, maybe painful swollen spots, which he doesn't have. Next, I'm going to check for range of motion and strength in his neck. Alright, can you, I'm going to do flexion and extension. Can you put your chin to your chest, please? Then look up. Alright, then look side to side. And then, can you touch each ear with your shoulders like that? Perfect, so he has full range of motion in his neck. Next, I'm going to check for strength. Can you push against my hand, please? Perfect, turn against my hand, perfect. So he has full strength against resistance in his neck. That would rate that as a 5. Next, I'm going to do his shoulders. So can you stand up for me, please? I think it's maybe easier.
Yeah.
Alright, so can you extend your arms out like this, please? And then backwards. Perfect. So I'm gonna do abduction and adduction now. Can you put your shoulder out, put your arms out like that, like this? Perfect. And then I'm gonna check for adduction. So can you put your arm across your chest like that, one at a time? Yeah, try to keep straight. Sure. Okay, perfect. Now do the other arm. Perfect. Now I'm going to do internal rotation. So can you take your arm and put it behind your back like that and touch your shoulder?
Touch my shoulder. Like.
Yeah, like that. Okay,
Oh.
perfect. Perfect. That's okay. And then can you put your arm like this? And then I want you to rotate your shoulder like that. Perfect. So I would have him do that on both sides. Normally, he has full range of motion in his shoulders. I'm also gonna palpate the joints of his shoulders. So, perfect. His clavicle. I would be feeling for any like crepitus, any pain, any redness or swelling. I'm gonna the scapula. I would palpate. Next, I'm going to assess the strength of his shoulders. So can you put your arms out? Alright, so don't let me push you down. Perfect. So don't let me push up. Perfect. So he has full, alright, relax. He has full strength in his shoulders, full strength against resistance. So next I'm going to do his elbows. I'm going to do the range of motion of his elbows. Can you bend your arms like this, please? I'm sorry. Perfect. Now I'm going to do pronation and supination. So put your arms go like that and like that. Perfect. And then can you go, I'm going to test the strength. So can you go like this, please? Alright, don't let me pull.
Oh.
Alright, don't let me push. Perfect. Alright, good job. It's okay, sorry. Next so he has full strength and range of motion in his elbows. So next I'm going to do his wrists. Can you put your hands up, please? Can you put your fingers up and then down? So that's flexion and extension. Then I'll do inward deviation. So go like that. No, sorry, not with your arms, I'm sorry. Just with your wrists.
Oh.
Like that, and then out. No, sorry. Out like this.
What do you want? Okay.
Perfect. Perfect. So he has full range of motion. Now I'm gonna check the strength of his wrists. Can you put your arms up, please? Or both of them. Alright, so try to push your hands up against my fans. Alright, now push down. Perfect. So he has full range of motion and full strength against resistance, 5 out of 5, in his wrists. Next, I'm going to do his fingers. So can you put your hands out again? Make a fist for me. Fan your fingers out like that. Can you go like this? And then touch each thumb to each finger. Perfect. And I want you to squeeze my fingers for me. Yeah, squeeze your fingers. No, put like with your whole hand, squeeze my
Oh.
That's okay. Alright, perfect. Perfect. So he has full range of motion and full strength against resistance of his hands. I'm also going to palpate all of his joints. So I would palpate the structure of his elbows for redness. For any swelling or pain or crepitus. I would do both of his wrists too. And then I would do each finger, each joint of the finger, and including the palms. Alright, perfect. So now we're going to do hip range of motion. So I would palpate his hips, the joints of his hips for any redness, pain, discomfort. Can you kick your leg out for me, please? So that would be flexion, and then perfect, and step forward so you don't hit the couch. And then kick back. So flexion and extension. So we'll do abduction and adduction. So kick your leg out like this. Perfect. And then like that. So that would be adduction. And you could also do internal, external rotation. Go like this with your, rotate your, perfect. And out like that. Perfect. So he has full range of motion in his hips. You could also do this lying down, but I thought it would be easier standing up. And then right now, to check range of motion of his knees, he is standing, so his knees are extended. I would also palpate the joints of his knees for any tenderness or, crepitus or swelling. Next, I'm going to check the strength of his hips and his knees. Alright, sit down for me, please. So to make sure that he has strength in his hips, I'm going to ask you, try to sit forward, it'll make it easier. So can you try to push against my hands in. Perfect, and then push out. Perfect. And then so he has full strength against resistance in his hips. Now to do his knees, I'm gonna have him push against my hand. Alright, push against my hand with your leg. Alright, perfect, then push back. Perfect. Next, I'm gonna go down to his ankles. I'm going to palpate the joints in his ankles, again for any abnormalities. Next, I'm gonna do range of motion. So can you flex your feet up, please? So dorsiflexion, then down. Plantar flexion, then move your feet in. Perfect, then out. Perfect, and then I could check for strength. So can you, I know this is kind of hard to if you don't, push my hand up with your, and then down. Perfect, so he has full range of motion and full strength against resistance in his ankles. Next, so I would do all this on both sides, but for time purposes, we're just gonna do one side. Alright, can you stand up? We're gonna do your spine. So I'm going to assess the spine now. First, I'm gonna just look at the spine itself. I wanna make sure it's midline. I wanna look for any, obviously, scoliosis or kyphosis. I'm gonna palpate this spine itself. I'm gonna start at the top of the vertebral column. And then I'm going to palpate down. I'll palpate each vertebra individually for any obvious protrusion or elicit any pain response. Perfect, his is nice and midline. Next, I'm going to assess for range of motion of his spine. So we'll do flexion. Can you try to touch your toes, please? Then extension, bend back for me. Perfect. We can do lateral bending, so go like this. Yeah, try to keep your hips still. All right, keep your hips in place and bend. Perfect. All right, and then I can have him rotate, so I'm gonna hold his hips in place while he rotates, so rotate side to side with your spine. Perfect. So he has full range of motion of his spine. I palpated it. There's no obvious abnormalities. Next, we're going to go into the neurological part of the assessment. So I am going to start off with his mental status. I know he's alert and oriented, he's awake. I'm looking at his parents, he appears well. We can do cognition. I would also, assess his mood and his affect and speech, which is all within normal limits. Next, we'll do cognition, so I'll do some cognitive tests. All right, can you count down from 100 by 7? Just do a couple.
93. I'm sorry.
It's okay.
93, 64.
All right, perfect.
Oh my God, did I just go from 93 to 64? Yeah.
So we have to work on that. That would be abnormal, and that would definitely need follow-up on, which we'll talk about after. It's okay. Don't worry about it. Because I couldn't do it either. Next I could test his memory, so I can test his recent memory. I'm gonna give you 3 words and repeat them back to me. All right, mouse, car, pizza.
Mouse, car, pizza.
Perfect. So his recent memory is intact. I could do his remote memory. Where'd you go to elementary school?
Jenkins.
Perfect. So his remote memory is intact. So I could just assess his overall memory. Next, you can do higher intellectual thinking. So I could ask about his judgment. What would you do if you spilled milk?
Clean it up. I cleaned it up with a paper towel.
Yes, I would ask like his judgment. If it was someone with a job, I could be like, what would you do if you lost your job? Next, I could have them relate 2 things to each other for reasoning. So what do apples and oranges have in common?
They're both fruit.
Perfect. All right, so he passes the cognitive test minus the sevens test. So next I'm gonna assess his cranial nerves. You can sit down if you want for this part. So cranial nerve number 1 would be smell. I don't have anything on me. Actually, shut your eyes. I'm gonna have you smell this, and then so I'll ask him what the scent is. All right, what do you smell?
Like vanilla or like pumpkin or something?
Perfect. So you can smell the candle. All right, you can open your eyes. I would have him occlude each nostril, and I would also touch each nostril individually for smell. You could use different types of smell. Next is cranial nerve number 2. So that's going to be his visual acuity and visual fields. We could do, for visual fields, you could do the finger wiggle test. You could also do the Snellen and eye chart for acuity. Cranial nerve number 3 would be his pupillary response. So I can shine a light in his eye. I'm looking for reaction, accommodation. Perfect. Both of his pupils constrict equally. Cranial nerves number 4 and 6, I'm gonna test for his extraocular eye movements with the 6 fields of gaze. Follow my finger. Perfect. Good job. And then I'm gonna check for convergence, so follow my finger in. Perfect. Cranial nerve number 5 would be the trigeminal, so I'm going to first do the motor portion of it. All right, open and close your jaw. Perfect, bite down. Perfect. So I would palpate his temporal and masseter muscles. I'm gonna do the sensory portion of that. So I'm gonna ask him if he can feel me touching his face. Can you feel this? Wait, sorry, shut your eyes. So I would do it on both sides, but can you feel that?
Yeah.
Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Perfect. Cranial nerve number 7 would be Facial expressions, so can you raise your eyebrows, close your eyes tight, puff out your cheeks, smile. Perfect. Alright, so they're all intact. Cranial nerve number 8 is the acoustic. I would do the whisper test. I would say one word and have him repeat it back to me. 9 and 10 would be his vagus and glossopharyngeal. So can you open your tongue and, stick out your tongue and say ah?
Ah.
Perfect. So I would look at, his palate and make sure it rises symmetrically. I'm looking at his uvula. I want to make sure it's midline. Cranial nerve, and also I would assess the swallowing. Cranial nerve number 11 would be the spinal accessory. Can you shrug and then turn your head side to side? Perfect. Other way, perfect. So I would feel, make sure that's intact. And number 12 would be his tongue. You can stick out your tongue, wiggle it side to side. Perfect. I want to make sure it's midline. And his tongue looks good. So next we're going to do the reflexes. I'm going to do his bicep reflex. So I would put my finger down. I would feel his bicep itself. Perfect. And I want to make sure that it contracts his tricep, his brachioradialis. Sorry, relax your, for time purposes, just do one side, but I would make sure his beats both sides react. I would do his patella. Alright, try to move forward. So I'm going to strike his patella and make sure his leg moves. You feel it?
Yeah.
Okay. This is hard because his legs aren't like swinging up the table, but normally the legs should swing out. His Achilles, so I'm going to have him partially dorsiflex so I can feel the plantar flexion when I strike his Achilles. Perfect. Perfect. I'm gonna do assess for clonus, so I'm gonna move his foot up and down. Feels good. All right, next we're going to do the assess for sensation of his upper and lower extremity, so shut your eyes. And put your arm. Can you feel this?
Yes.
Can you feel that?
Yes.
How about that?
Yes. Yes. Yep. Mhm. Mhm.
For that, you could do different materials, but we're just gonna do that. Next, I'm going to assess for rapid alternating movement. So can you flop your hands like this? Perfect. Now touch my finger, then your nose. Perfect. Can you touch each finger like this? Perfect. And then I'm going to assess his gait. So can you walk back and forth for me, please? Then back. Perfect. And then can you walk heel to toe?
Wait,
Like this.
Oh.
Perfect. All right, you can sit back down. Let me just think if I missed anything. Nope, I think that's it. Thank you so much.